Going to the doctor and your results keep showing your A1C is increasing, so you're being prescribed more and more insulin, and it seems like it's a never-ending cycle. Do you know that you can actually end that cycle? And I'll show you how in this video. If you're on the verge of diabetes, or you have a friend or a family member that's on the verge of diabetes, or maybe you've recently been diagnosed with diabetes, you're going to want to watch this video. In this video, I'm going to share with you how to lower your A1C naturally. Before we dive in, let's talk about what your A1C actually is and how you can measure it. Your A1C is a measurement of your blood sugar levels over the last 2 to 3 months as a percentage. It's a blood test that measures the percentage of hemoglobin on your red blood cells that's coated with sugar. So the lower the better, but you want to make sure that it's not too low. When your A1C is too low, that's called hypoglycemia, and that can cause a number of health issues. A normal healthy A1C is below 5.7, but remember, you don't want it to stay too low for too long. If you keep your A1C below 5 for too long, this can be dangerous. If you are above a 5.7, the next part of this video is definitely for you. Between 5.7 and 6.4 is pre-diabetes, and anything over a 6.4, you are a diabetic. And typically to confirm diabetes, you need 2 separate tests. Rather than wait for those 2 tests, let's see what we can do to correct your health now. In order to correct and lower your A1C, you need to make some adjustments to your health. First, a majority of people that have a high A1C, it's because of their diet and what they're putting into their body. You really need to clean up your diet. You really need to eat less processed foods, cut out your sugars. Yes, that also means to reduce your carbs, which turn into sugars. Try eating more fruits and vegetables. You also need to increase the amount of fiber that you have. This can be through eating more beans or avocados or whole grains, or even having a fiber supplement on a regular basis like I do. I try to have a variety of fiber as well as a supplement to make sure that I get enough fiber on a daily basis. You also need to cut back on how often you're eating. Maybe try skipping breakfast. I did a video on this, check it out. Or better yet, try just skipping those snacks throughout the day. This simple solution will amaze you at what it will do for your overall health. But if you really want to correct your A1C and do it quickly, then try adding in some exercise. You should really be getting about 150 minutes of exercise per week, about 20 minutes per day. And no, you can't just do 150 minutes straight and count that as your exercise for the entire week. Another way that will help you to lower your A1C is to reduce the amount of stress that you have. Stress hormones have been known to raise your blood sugar. So you really need to get rid of that chronic stress. Maybe try some meditation or some yoga, or once again, going back to exercise. The last way to lower your A1C is sometimes not the most popular, but you really need to cut out or especially just reduce your alcohol consumption. Most alcoholic drinks have a ton of calories and a lot more sugar than you ever need. So if you want to avoid that path to diabetes and the medication, then lower your A1C.